Hello friends, welcome back to Complete Medical Coding. Today let's learn few hierarchy, few guidelines from infusion. Okay, infusion, hydration and injection. So friends, if you are new to the channel, please support me by subscribing to the channel. And let's move to the guidelines one by one. Coding infusions, hydration and injections is much easier when you understand the hierarchy for the following. So basically there are three hierarchy. Okay, for coding, infusion, hydration and injections. The first one is facility hierarchy or facility reporting. Second one is that you should know differences between initial, sequential and concurrent. And last, documentation requirements. What are the documents? What are the documentation that we need to include? Okay, so let's check one by one. First is the facility hierarchy. What is facility hierarchy? Facility hierarchy for infusions, pushes and injections. So these are the steps, various steps or the order for facility hierarchy. Okay. For chemotherapy, if you are coding chemo infusions, you have to code first the chemotherapy infusion, followed by chemotherapy IV push, and then lastly chemotherapy injection. Okay. So if in the documentation, if there is any any procedure with chemo infusions or injections present, you have to code initially chemo infusion, followed by chemo IV push and then injection, chemo injection. Okay. Then we have to code therapeutic prophylactic or diagnostic infusion, therapeutic prophylactic or diagnostic push, therapeutic prophylactic or diagnostic injection, and then finally hydration. So this is the hierarchy. This is the series that you have to order according to the documentation. If everything is present, initially you have to go for chemo infusion, chemo IV push and chemo injection. Then followed by the IV push, the injection, okay, that is therapeutic prophylactic or diagnostic infusion, that is injection, IV push, and then injection, therapeutic injection, followed by hydration. Hydration should be the last procedure. Okay. Now, in order to correctly code a service, we have to look into these following questions. We have to remember the answer for these questions. Okay, 4 things you need to remember. First one, why is the patient here? Why is the patient here? Means for what purpose the patient has visited the hospital. Then, what did the patient receive? What are the services that patient received from the hospital? How was it given? The route of admin, that is what is mentioned here. How was it given and how long did it take? The duration of the procedure. Okay, so these are the 4 things that you need to remember. Now, our coding guidelines tell us that we code the cancer diagnosis primary for chemo infusions, right? For chemo infusions, you have to code for the cancer diagnosis. But when we code hydration, in case of hydration code, the reason for hydration is the primary diagnosis and not the malignancy. Okay, if you are coding the hydration, means if the patient has come for getting the hydration, for getting the IV fluid, you have to code initially the diagnosis should be hydration code and not the malignancy code. Okay. And if the patient is getting both chemo and hydration, you should report both diagnosis codes. That is already understood, right? If patient is getting both chemo and hydration, you should code for both, with chemo as the primary diagnosis. So this much is the facility hierarchy. Okay. Now the second hierarchy, the difference between initial, sequential and concurrent. What is initial service? Initial service, these are the points that you need to remember for initial service. Initially what we have to, or initially why is the patient here, or what are the things that need to be documented for the initial service. Why is the patient being seen? Hierarchy does not apply to subcutaneous or intramuscular injections. Order of service delivery does not determine initial service. Order of service delivery. Okay, so these are the 3 to 4 points. What is the purpose of patient visit? But this hierarchy doesn't include IM injections. This is only for IV cases. Okay, subcutaneous or IM injection, this doesn't apply. Order of service delivery does not determine the initial service. There is only one initial service unless two separate IV sites are used and medically necessary. So if it is only one IV site, then only we can call it as an initial service. If it is a two separate IV site which are medically necessary, we cannot call it as the initial service. The patient returns for a separate medically necessary and reasonable encounter on the same day. That also we cannot consider it as an initial service. Means after the initial service, the patient has returned back for a separate another encounter in the same day. If it is same day, patient has returned back for a separate medically necessary procedure, you cannot consider it as an initial service, right? Then append modifier 59 to the second initial service. So in that case, you have to append modifier 59. 59 modifier means distinct procedural service. Okay, to the second initial service. Now, moving on to sequential administration. What is sequential? From the word itself, we will understand when multiple drugs are infused one right after other. One after the other, if the multiple drugs are infused, that is called sequential administration. This must be a different drug through the same IV axis. Here the drug will be different, but the IV site will be same. And there should be a clinical reason for performing the sequential and concurrent administration. Okay. As per simply we cannot give. There should be a medically necessary clinical reason for performing sequential and concurrent administration. And here is an example to show sequential administration. For example, drug A was infused from 1 to 2, means 1 hour. And then drug B was given from 2:05 to 2:45, like that. Okay. Similarly, what is concurrent administration? This is when multiple therapeutic or diagnostic medications are infused simultaneously through separate bags through the same vascular access site. More than 2. When multiple therapeutic or diagnostic medications are infused. But this doesn't include hydration. These are for the drugs only. Okay, multiple drugs. Multiple therapeutic or diagnostic medications or drugs are infused through separate bags, not through the same bag, but the same vascular site, same IV site. Okay. Here is the example. Drug A 1 to 2, 1 hour. Drug B 120 to 220, like that. Now moving on to the third hierarchy, documentation requirements. What are the documents required? Documentation recommended to ensure correct assignment of infusion or injection codes includes. So these are the points that needs to be remembered. Requirements, documentation requirements. Which substance or drug is administered, the mode of administration, the access site, all these have to be documented. Okay. The start and stop times as mentioned in the table I'll be showing in the next slide. Start and stop times, the rate of administration, the dose and volume of drug administered, evidence the line was flushed when complete, amount of drug wasted or discarded. You have to append it with modifier JW. If in case that some amount of drug is wasted or discarded, then you have to append it with modifier JW. And this is the table, time documentation requirements, how to code the time for chemo or therapeutic infusion, and then hydration, it is separate. For chemo or therapeutic infusion, for the first hour is considered as 16 to 90 minutes, whereas hydration, first hour in the sense first code, the initial code, okay, primary code, considered as 31 to 90 minutes. And second hour is considered for chemotherapeutic infusion is 91 to 150 minutes, whereas for hydration it is 91 to, it's same, 150 minutes, second hour, additional, okay. Same, third hour, also same, 151 to 210 minutes, 151 to 210 minutes is considered as the third hour for hydration. Now, one thing to remember is that services leading up to and following an infusion are included or bundled in that service, such as flushing the line, also included as part of the operative service under the outpatient prospective payment system and therefore not separately billable. So when you will code, it means when you will code for infusion, hydration, along with the following procedures. Which are the procedures? Anesthesia, hydration, anxiolytics, antibiotics, post-operative pain medication. You cannot code it separately. It's already bundled. It's a bundled service along with the post-operative services. When antibiotics is given, anesthesia is given. Okay, you cannot code IVS separately. So these are the things about points to remember in infusions. Now let's move on to hydration. It's easy. Hydration. To separately build hydration codes 96360 and 96361, documentation of supporting signs and symptoms such as hydration or fluid loss is required. Okay, how to code hydration? The initial code is 96360 and for additional hours we will code it as 96361. So in that case you have to in order to build separately, the documentation consists of signs and symptoms. Means for the additional codes there should be signs and symptoms such as dehydration, fluid loss. In that case only you can code the hydration codes, both 96360 and 96361. Also for some abnormal lab studies that shows elevated BUN, blood urea nitrogen, okay, creatinine, glucose or lactic acid are acceptable. So in order to code hydration, there should be diagnosis like dehydration or fluid loss, or else abnormal lab studies for urea, nitrogen, creatinine, glucose or lactic acid. Generally do not code hydration when the purpose of IV fluid is to keep an IV line open. So these are the points where you should not code hydration. If the purpose of IV fluid is to keep an IV line open, if the fluid is the vehicle in which the drug is administered, used to accommodate a therapeutic IV piggyback through the same IV axis, used for routine administration of IV fluids pre-post-operative without supporting documentation of signs and symptoms, and if it is given concurrently. So in these cases you should not code hydration. Okay, hydration. You should not code for these 5 points that you need to remember. Now moving on to injections and vaccines, the last point, the last part. For vaccines, administration codes are dependent on the following: age of the patient, route of administration, provider counseling provided and documented, number of vaccines or components. So these are the admin codes. You should remember all these 4 points for the admin codes: age of the patient, route of admin, provider counseling, number of vaccines or components. Now, you need to report the administration codes in addition to the vaccine codes, even if the vaccines are state supplied or the patient picks them up from the pharmacy. If in case more than one vaccine is administered, you have to code the additional admin codes, okay, even if the vaccine is given from pharmacy or from the hospital. Also important is to look at the code descriptions. You have to check for the descriptions, what is mentioned, what is included. So you are billing the correct number of components. You should check if there is any, if the components mentioned in the vaccines are like the number of components. What are the number of components? Accordingly, you have to code the admin. This is an example. For example, for COVID-19 vaccines, make sure you are aware of which vaccine the patient is getting. For COVID-19, there are different types of vaccines, right? So whether it is and also first, if it is a first booster, second, third, whatever it is, first vaccine, first shot, second shot, third shot, or first booster, etc. Like that, you have to check for vaccines like COVID-19 vaccines. So these are few very important guidelines from the topic infusion, hydration and injections. Is you will be getting in examinations as well as for getting jobs in interviews also. You will be asking questions. You will be getting questions from this part. So friends, if you like the video or if you find this content useful, please like and share. And if you are new to the channel, please subscribe to the video. And thank you so much for supporting me. Stay tuned, friends. Let's see you in the next episode. Thank you so much. Bye.